Hi, I'm Dr. Carrie Harrell. I'm one of the psychologists here at the Menninger Clinic. I'm the coordinator for our youth division, and I work primarily with our young adults and our adolescents. One of the things that I often think about is how positive thinking has been weaponized against people with mental health struggles for a long time. Have you ever heard someone who's depressed be told, hey, why don't you just look at what you have to be grateful for? How can you be depressed if you have so much going on in your life that's good? So one of the first things that I talk about in regard to positive thinking is that this is not a this or that. To look at the positive, to look at things in your life that are going well, to pay attention to things that you have to be grateful for, doesn't mean that you're not paying attention to the parts of your life that are challenging, places where you have struggles. So when I think about positive thinking, I really try to think about the fact that it can coexist right alongside with the areas we struggle. I think it's important to consider the fact that most things that we do in our mind are practices. And we call them practices because that's exactly what it is. It takes practice. So when we're trying to work on positivity, there might be ways in which we're really used to getting down on ourselves or getting critical. We have to work really hard to learn a new way of thinking, and we have to practice it over and over again. Part of that also means that we don't get critical of ourselves when we find ourselves falling back into the primary way we've known how to think, which might be a little bit more negative. So it is something that we can not only work on, but that it does take some time to have it be more of an automatic way of thinking. There's a few things that can kick off that practicing. One of the first things is to try to just catch when that spiral starts. A lot of times these negative thinking patterns can become really ingrained and almost subconscious. So just stopping to notice, hey, I'm getting really critical, and be intentional about how you might think about things in a more positive light. Also, you want to make sure you're prioritizing connection. One of the best ways that we know how to change our thinking pattern is to talk it out loud with another person and allow there to be space for them to give us feedback in return. Another piece that is important is learning how to do something with those thoughts when you catch that you're being negative. Reframing your thoughts, which is a pretty critical part of cognitive behavior therapy, it can look like, hey, I'm getting really down. Can I check the facts? Can I look at what's going on? Can I see if there's another way to think about this? And finally, celebrate the small stuff. A lot of times when we're talking about gratitude and we're talking about positivity, it is the small stuff in our life, and paying attention to that and being patient with the process. So one of the major aspects of a type of therapy, and really just a type of process in therapy called mentalizing, has to do with pausing and prioritizing reflection over reaction. Our brains are actually not very good at thinking and using our logical part of our brain when we're having a high emotional reaction. So when we're in that space where we're having a big reaction, just taking a pause, taking a break, saying, hey, I need a few seconds to think about this. I need to do some things that help me kind of calm down. One of the best ways we know how to pause is taking a second to use some coping skills, whether that is something as simple as taking a walk, taking some time for exercise, or even a cold shower, hot shower. Being able to do some things to help our body re-regulate literally helps us to have more access to our mind and the part of our mind used for logic. One of the areas that I am really passionate about is self-compassion, which might feel like an odd thing to talk about when we're talking about positivity, but it's really similar in this idea that to be kind to yourself and to consider the things in our life that are challenging does not mean that we're ignoring or washing over the things that are hard. One of the fears that I've heard from patients about positivity is that if they garner hopefulness, if they notice their strengths, if they are aware of things in their life to be grateful for, it will take away from, it will downplay, and it will detract from their experiences of pain. And so oftentimes one of the lessons that I really work with patients on is how do we acknowledge both? So if you are in a tough situation, we can sit with, process the grief, the struggle, the pain, while also noticing the things that are going well, including progress and strength that is occurring alongside that journey. One doesn't wash away the other. Our mood is incredibly sensitive. Research has found that if you put a pencil in your mouth, which stimulates your face into a smiling position, it actually drastically can improve our mood. So something as simple as changing our facial expression can make us in a better mood. You can imagine how much language and the dynamic of how we talk to ourselves can impact our mood. Ultimately, Like we've discussed, one of the first and most important things is being mindful and being intentional about how we talk to ourselves. How often have you taken a wrong turn and not listened to the GPS and immediately been like, you're so stupid? That's the kind of language that we really want to catch. We want to notice that and then kind of intentionally insert something more compassionate. Be aware of our mistakes is what they are. They're mistakes. Being aware of the fact that we're going to have moments where we do feel critical of ourselves, and to be acknowledging that alongside with being kind to ourselves. The end goal, treat yourself like you would a friend. If you wouldn't catch yourself saying that to a friend, try to notice the way that you could say that differently to yourself. One reminder that I often give patients is that we don't have a lot of control over what we feel, but we have a lot more space to control what we do with how we feel, how we react to it, and how we process it. What and why we feel what we feel comes from all sorts of things, including our temperament, our past experiences, our body. Paying attention to that, validating those feelings, is actually what gives us some space to control how it shows up in our life and how we react. We really want to try to not ignore our feelings, and one of the things that can lead people to wanting to ignore their feelings is they feel like their feelings are wrong or not appropriate for the situation. We don't have a lot of control over how we feel what we feel and the intensity in which we feel it. We do have a lot more control over what we do when we have a feeling, how we process it, and how we cope with it. To make space for those feelings, we have to first not be judgmental of them, and we have to be able to talk about them and process them. And ultimately, validating and giving space for feelings is what helps us to be able to feel like we have more control over our behavior and what we do with those feelings. One of the most important places to start is recognizing that you might need help. Sometimes when we're caught in these patterns and we feel really stuck in them, like I can't even imagine being self-compassionate, I can't even imagine getting out of this loop, that's when we know we're gonna need some support. We need a trusted friend, a colleague, a therapist, a provider to step in and help us to intentionally break that cycle. Again, it is totally okay to need support. It's actually pretty normal that for many of us, when we're really stuck in a mindset, we need to find someone to talk to. So there's help out there, and so I would encourage you to reach out.